Osteopathy is a fascinating field of manual therapy focused on diagnosing and treating structural misalignments in the body. We use specific manipulative techniques to address these misalignments, but there's so much more to it. Defining osteopathy. The term osteopathy is made up of two parts. Osteo, meaning bone, and pathy, meaning disease. But osteopathy isn't just about bones or diseases, it's about understanding the body as a whole and addressing issues we call osteopathic lesion. What is osteopathic lesion? Still's views of the osteopathic lesion. An all-encompassing lesion transcending the physical, emotional, and spiritual aspects of the patient. Physical aspects such as the spine, visceral aspects, muscular aspects, emotional aspects, a changing view of oneself, more temporary than spirit. Spiritual, a person's deeper view of self, more permanent than emotion. Today many schools are teaching this concept as the somatic dysfunction, as a purely mechanical lesion, often as spinal mechanics only. Some esoteric schools see the energetic components only. By not understanding the totality of the concept, osteopathy has been watered down to symptomatic mobilization of the spine. Diagnostic process, the ARTS or TARTS model. Once we've identified a key lesion, the next step is diagnosing it accurately. Osteopaths often use the ARTS, or TARTS, model, which stands for 1. Asymmetry, we check for any postural imbalances. 2. Restricted range of motion, observing joint movement helps detect restrictions. 3. Tissue texture changes, we feel for any differences in muscle or fascia texture. 4. Sensitivity/tenderness, tender points in certain areas indicate dysfunction. Each of these gives us clues about the underlying osteopathic lesion. Step by step. Diagnosis. Let's go a bit deeper into how this works. First, we look at the whole body, examining posture for asymmetry. For instance, we might notice a shoulder rotated inward or a hip tilt. We assess range of motion through movements like walking, which tells us where restrictions are present. Next, we perform something called layer-by-layer palpation, feeling each layer of tissue. For example, if a patient has internal shoulder rotation, it might seem like a muscle issue. But with deeper palpation, we could find the cause is a fascial restriction from an old abdominal surgery. Case example: shoulder internal rotation. Here's a practical case. Imagine a patient comes in with internal rotation of their right shoulder. At first, we might think the problem is with the chest muscles. But after palpation, we find tightness in the fascia around the lower abdomen due to a 20-year-old appendicitis surgery. This scar tissue in the abdomen has created fascial tightness, subtly pulling the shoulder out of alignment. By addressing this fascial restriction rather than focusing solely on the shoulder, we can correct the somatic dysfunction and relieve the shoulder and even neck pain. Osteopathic manipulative techniques. Some of the key techniques we use include: 1. Myofascial release, releases fascial tension to restore muscle and tissue alignment. 2. Counterstrain technique, reduces pain by positioning the body comfortably to release tender points. 3. Facilitated positional release, FPR, targets specific points to ease muscle tension. 4. Muscle energy techniques, MET, uses controlled muscle contractions to improve joint and muscle function. Cranial and visceral manipulation are aimed at restoring balance and function by addressing restrictions in the cranial bones, fascia, and internal organs. Ligamentous articular strain techniques are gentle osteopathic methods that restore joint balance by releasing tension in ligaments and promoting natural alignment. Lymphatic release in osteopathy enhances fluid drainage and immune function by gently stimulating the lymphatic system to reduce congestion and promote healing. How OMT resolves issues. With OMT, we don't just address localized symptoms, we aim to restore the body's natural balance. This holistic approach can provide lasting relief by addressing the root cause. When the body is balanced, it often resolves issues that patients come in with, like neck pain, back stiffness, or shoulder restrictions. Each technique is chosen based on the exact nature and location of the osteopathic lesion. Principles and philosophies of osteopathy. Osteopathy is founded on key principles that guide its practice and philosophy. 1. The body is a unit. The body, mind, and spirit are interconnected and must be treated as a whole to achieve optimal health. 2. Structure equals function. The structure of the body directly influences its function, and vice versa. A balanced structure ensures proper function, and misalignments can lead to dysfunction. 3. The body possesses self-healing mechanisms. The body has an innate ability to repair and restore itself when supported by optimal conditions and balance. These principles form the cornerstone of osteopathy, emphasizing holistic care, structural integrity, and the body's natural capacity for healing. Osteopathy, beyond techniques. What Dr. Stephen Sannett, DO said about this: osteopathy is a set of ideals bounded by philosophy and grounded in anatomy and physiology. It is not a set of techniques. Osteopathy is a unique approach, connecting every part of the body to create a harmonious system.